Emergency care or treatment given to an injured or ill person before medical care is obtained is known as first aid. And today's lesson, we are going to learn about first aid.
Remember to follow me on Instagram at savvyshay_tt. Subscribe, comment, and like.
Hello everyone and welcome. I'm Shay. In simple accidents, all that is necessary is first aid. But if the injury is serious, a doctor must always be sought. On arriving at the scene, the first aider must look at the situation, arrive at a decision for each problem, and give immediate treatment, bearing in mind that a casualty may have more than one injury and that some casualties may require more urgent attention than others. The first aider should be calm and confident. If the casualty or victim is conscious, the first aider should talk to him, listen to him, and reassure him. The victim should be handled gently and carefully at all times and move about as little as possible. With serious injuries, the first aider should ensure that the victim is conveyed without delay to hospital. A brief written report or message should be sent if necessary, stating what has happened and what has been done. As the name implies, this is the first help and attention given in the case of an accident using materials and facilities available at the time. In many countries around the world, various boards and councils have been established to set and maintain standards of safety to protect consumers from unsafe goods. In many cases, manufacturers have to submit their products for testing if they are to be allowed to sell them to the public. Goods that meet such requirements bear a symbol of approval from the board that governs these particular goods. Many homes now have domestic fire extinguishers, fire blankets, or even smoke detectors, which are simple to operate and effective in use. They should comply with the relevant standards and be regularly checked. It is important to follow the manufacturer's instructions for using extinguishers and to remember that water-operated ones must not be used on electrical or chemical fires. School, place of business should have a first aid kit available. This need not be elaborate, but should be clean and roomy, and it should be easy to get at but out of reach of small children, such as a box may be painted with white with a red cross on it to make it easily seen, even by people who do not know its usual place. The contents of the first aid box may vary, but the following is a useful list. A small, strong, sturdy container, wall-mounted or placed in a safe spot, a good supply of band-aids, a roll of adhesive tape, a small box of absorbent cotton, a small box of sterile gauze, smelling salts, a first aid book, a pair of scissors, tweezers, safety pins, and other such items for treatment of cuts. Don't forget aspirin or similar pain-killing tablets, eye bath, and a clinical thermometer. Next is a list of rules for keeping a first aid box. Replace items as soon as possible after they are used. Keep up supply of the contents. Check the kit after each use, or if not used, then once every 12 months. Check that items are in good working order, have not deteriorated, and within the expiry date. Ensure that sterile items are still sealed. Keep it clean. Have your hands washed before applying any dressing. Developing first aid common sense is an important part of providing first aid care. First aid, properly given, can reduce the effects of injuries and medical emergencies. It can help a seriously ill person stay alive, and it can mean the difference between a short or a long stay in hospital. When responding to an emergency situation, remain calm and apply the 4 emergency action principles. These are: 1. Survey the scene to decide how safe it is for you. 2. Do a primary survey of the victim. 3. Phone the emergency medical service. And 4. Do a secondary survey of the victim. If an accident occurs in the home or anywhere else, it is important to know how to treat with the injured person before expert medical help arrives. It is very useful for anyone to take a first aid course. For instance, if someone has stopped breathing, it is important to start mouth-to-mouth resuscitation before medical help arrives in order to save their life. The brain suffers damage if it is without oxygen for more than 3 minutes, and death will follow soon after. What would you do? Or what should you do? Check the patient's breathing if it has stopped. Clear the mouth by removing false teeth, dirt, or any object. Bend the head back with one hand and push the jaw upwards with the other to lift the tongue away from the back of the throat. Squeeze the nostrils together. Place your mouth over the patient's mouth and blow gently. Watch for the chest to rise. Let the chest fall. Take your mouth away. Then repeat about 15 times a minute, continuing until the patient starts to breathe again or until help arrives. Place the patient in the recovery position with the head to one side in case of vomiting and one arm underneath to prevent the patient from rolling on his or her back. If the heart has stopped, it will need to be massaged. Pressed on the lower part of the breastbone using the heel of one hand and the other on top. Press about once a second, 5 times, then continue mouth-to-mouth resuscitation. Repeat until the heart starts beating and breathing is continuous. It can be exceedingly difficult, even for doctors, to make a diagnostics at times on emergency without the support of hospital testing facilities. Often it would be impossible for the first aider to obtain a reliable history from the patient if he or she is unconscious or severely shocked. If the first aider is confident that he or she can identify life-threatening conditions in the first instance, then detailed history taking is of secondary importance. When a patient is unable to give details of events leading up to an accident or emergency, then this information should be sought from any relations or bystanders who might be able to provide useful information. Wherever possible, the first aider should try to ascertain the patient's name and age and whether or not he or she has any significant medical problems or is currently taking any medications for a specific condition. Doing a first aid course is recommended to give you the knowledge and skills to provide care and first aid assistance. We have come to the end of the lesson for today. I hope you would have learned something in this lesson. And do remember, every day you learn, you grow. So keep learning and you'll keep growing. Bye for now.